Okay, good afternoon, everyone. As Rich already said, I'm Neha, Tanna. I'm actually a quick introduction. I'm a practicing physician, but also have a technology startup and also work in a life sciences investment fund. So I've got lots of different hats on, but I was really excited by the topic because the NHS is something that's very important to me, and technology is very important to me. And technology has impacted our lives in every aspect, from personal portfolios to everyone's walking around with iPhones, and I really believe that healthcare is kind of lagging a little bit behind, but it should have an impact. So before I start talking about the next 70 years, I always find it helpful to kind of look back and look at where we've come from so that we can actually be grateful for where we have got to before we look forward. So a picture perhaps that may be familiar to some people, if we look back 70 years, you know, the healthcare system was a very different place. Everything was done by hand. Everyone had the white coats, which now we're not allowed, and the massive ward rounds. Things were done manually. And then the patient-doctor interaction evolved, became a little bit more maybe informal, a lot more about providing advice, a lot of information sharing, perhaps in our own ways, sharing things electronically. And now, for the physicians in the room, you may recognize this situation where you're in front of a patient and they turn to you and say, well, I looked on Google and therefore I know more than you, and therefore I know what I should be doing or what my relatives should be doing. And that frustration, I feel, we're in this phase where we can turn that into a positive rather than a hindrance. Technology should be an aid for us. It should be something that we can use to enhance healthcare and deliver the best care to patients as possible. So what next? And this is just my personal view. I am a bit of a closet geek, so excuse some of the extremes, but I will share my reasoning behind it. So these, I don't know if you can see from where you are, robots walking around the hospital. I know that a hospital in Japan already have this, where patients are sometimes greeted by a robot. They go and measure vital signs. Imagine if we had one of these that would ease the burden of either physicians, nurses, physicians' assistants, and that would free up so much more time for physicians, nurses, and other healthcare professionals to really take care of a patient in the best way possible, rather than having to deal with admin, having to do tests, diagnostic tests, in imaging. I know there's already been a lot of talk this morning around AI in imaging. There's been talking around interoperability. And I really do believe that these kind of machines will be coming out in the future. AI and technology in life sciences and diagnostics, I think looking at proteomics, genomics, blood work, I do think technology is going to have an impact in all of this, providing a wealth of information that perhaps we don't already have. I do think that AI in drug development has already taken place. Now, if we could shorten down the time frame for developing drugs, imagine the kind of technologies that we could bring forth to patients. And they wouldn't have to wait the 10 years that they're already having to wait now. Data, big data is a huge thing through monitoring devices, wearables. If a physician or nurse can imagine the amount of information that they'd have before they even reach a patient, and the kind of treatment plans and diagnostic plans that they could come up with, I think that with all of the information and analysis that technology can help us with, we'd be able to provide the best management and treatment plans for patients. And I caveat that with what humans bring is the benefit-risk analysis and the judgment about what is the best way to deliver or give to a patient. This picture is not even in the future, it's the here and now. It's robots in surgery, it's already happening, but it would be so great to see it being the norm. An accomplished surgeon in a teaching hospital guiding and operating from one room into another hospital up north or down south, wherever it may be, where they don't necessarily have the skills or the training, would be able to provide best care to the best patients despite geographical boundaries. Data, I've already alluded to it, but it's incredible to me. I think it's very, very important. The NHS has a wealth of information, again, real-world data, clinical data, patient outcomes. And if we could bring all of this together to provide the greatest way of being able to treat patients, I think that the NHS is going to just still maintain its position as one of the best healthcare systems in the world. Phones are already being used, there's apps, monitoring, and if this kind of information was shared with physicians or nurses and healthcare system in a real-time setting, whether we want it or not, would be able to provide a whole other dimension to understanding what a patient can go through. It's already happening in some areas in the States. Can be a little bit intrusive on time because it can be evenings and weekends, but with the right type of management, I think that you could provide the best care to patients again. So when I try and passionately explain some of these points to people, a question that I always get is, are we going to replace humans? And I absolutely don't think that we will. I work in an AI startup. I also help other sort of networks. And the human element, we will always need humans. The human element is about connecting emotionally, the soft skills, the negotiation, the empathy. And I think that we will deliver what computers can't. They'll just take over the burdensome stuff. They will be the vital aid to automating processes, analyzing data, and we will be able to empower patients to take ownership over their care and participate in their own care rather than just being spoken at. They'll just be involved in decision making. Computers will do the diagnosis and treatment, but the humans will bring the deeper connection element, putting all the pieces together and helping them to make lifestyle choices, behavioral choices or changing behaviors, and going beyond the clinical setting so that we can actually have a much more active impact on a patient's life and preventive rather than just reactively treating the ill. Thank you. I think that was 7 minutes. There we go.